This paper is about a phenomenon that we have observed in our study of abortion care availability in the state of Ohio. So a lot of previous research has focused on the number of clinics in a state as a measure of abortion accessibility. What counts as an open clinic isn't as clear as one might imagine. It's not just a matter of counting clinics that are open or closed, because there's actually quite a bit of movement in between. This fluctuation between open and closed and changes in service delivery that can result in a lot of instability around abortion care availability within particular regions in Ohio. And so what we were trying to document in this paper is what that phenomenon looks like and why it's important for abortion researchers and public policymakers and advocates to be paying attention to not just the number of clinics and whether they're open or closed, but what happens in the space in between. The findings that we present in this study are, one, to offer a definition of this concept of abortion care churn. We can measure abortion care churn by capturing the comprehensiveness of abortion services that clinics offer, which affects whether and how easily patients are able to obtain access to their preferred method of abortion. We can also capture and measure the gestational ages up to which facilities perform abortions as imposed by the state or dictated by institutional policies or the training of available physicians. Another way to measure abortion care churn is by counting the number of days per week that clinics are open, which may affect the number of patients they can see and the number of procedures they can perform. And we can also look at the price that clinics charge for procedures and how much financial aid they're able to give their patients. And we can also look at the wait times that clinics have, such that we can assess the clinic's capacity to meet the needs of the population it seeks to serve. Fluctuations in these dimensions of service delivery and related public perceptions of clinics' status can stymie or confound patients' access to abortion care. And we argue that measuring abortion care churn should be integrated into evaluations of abortion access in Ohio, but also nationwide, as we've seen an uptick in a sustained effort to regulate abortion over the last decade. We've noticed a lot of legislation in the state of Ohio since 2010 in particular. So in the last decade, there have been more than 15 regulations of abortion. The people that need to be paying attention to this problem of abortion care churn are policymakers, are healthcare providers who have not seen that this is their fight to fight. We want to make the case to reproductive healthcare advocates who are trying to ensure accessibility and availability of abortion, that their messaging needs to be really, really clear. That inflammatory messaging around potential clinic closures, it may capture the attention of the public, but it may also create confusion and generate misinformation that could ironically end up limiting access in some ways and create barriers and additional burdens. We think that in order to protect abortion access and to ensure that it becomes normalized as part of the reproductive health care spectrum of comprehensive care, that it can't be siloed any longer in freestanding abortion clinics, because that's actually where a lot of the problems that we're observing come from, is this sort of divorcing of abortion care from other types of reproductive health care. The reality is that abortion clinics already have a lot on their plate, and asking them to do more to solve this problem may just be kicking them when they're already down. So we are hopeful that this concept can have legs and really be used as a way to demonstrate the burdens associated with abortion restrictions that are being handed down at the state level across a variety of states.